Good morning, everyone. On the eve of this World Health Day, I, Dr. Randeep Nayyar, want to say something about the heart disease. What is a heart attack and how it is caused? What are the preventive measures and how should we go to prevent the disease? First of all, what we should know about the heart. What is the heart actually? Basically, heart, it circulates the blood in our body and continuously pumps the blood to the body so that our body functions normally. Heart also requires blood for its nutrition and to uh, function normally. So whenever there is impaired circulation to the heart started malfunctioning and it presents some symptoms. The major symptoms of this diseased blood circulation to the heart are, first of all, patient gets angina. Angina is a sort of pain when the heart is deficient in blood supply, the patient feels pain. And this pain is called angina. The other symptoms are whenever we exercise, we feel discomfort or we feel shortness of breath. And when the disease is so severe, we feel even shortness on even sitting or lying down. So other symptoms of this heart disease or the heart attack per se are dizziness, some difficulty in breathing, palpitations, vomiting. Some patients, they do present with some abdominal discomfort or abdominal pain, and even some patients, they come unconscious in the hospital. So these are the common symptoms a person should feel whenever he gets a heart attack. They have excruciating pain in the chest, they are sweating, and most of all, they are very anxious at all. So these are the common symptoms. So what will happen to a patient who presents with heart attack? If it's massive, patient can expire also. And if it doesn't come to the hospital at time, then he may have significant morbidity later on. Now, how we can prevent the heart attack? For general public, heart attack can be preventable. Patients who are hypertensive, who have high blood pressure, they should control their blood pressure. They should monitor the blood pressure regularly and keep at the optimal. And patients who are diabetic, they should have optimal control of blood glucose with regular checkups. And patient who smokes, and they should stop smoking and they should quit as early as possible. Patients are the general public who have dyslipidemia, like if they have high cholesterol, high LDL, and low HDL. Basically, LDL is a good marker, good lipoprotein, what we call as good cholesterol, and LDL is a bad cholesterol. So we should try to lower the bad cholesterol and upgrade the good cholesterol, that's HDL. We should avoid our sedentary lifestyles, regular exercise, so that we can keep our weight under control at least 5 times in a week, and we should exercise at least 30 to 45 minutes, especially aerobic exercise like cycling, like walking. Then you can do jogging also, swimming. These are the common exercises we can do. If the patient is taking alcohol, we should avoid alcohol and stop as early as possible or limit his alcohol intake to as minimum possible. So these are the usual things which we can do. In our diet, the patient is taking a lot of fats, we should lessen the amount as much as possible. Like saturated fats, they should not be more than 10% of our diet. Take a lot of fruits and vegetables and take unsaturated fatty acids. Take good oils that are in rich in unsaturated fatty acids or omega-3 fatty acids like olive oil, like sunflower oil, or rice bran oil. These are good oils for a healthy heart. And try to minimize our sugar intake, because sugar will increase the calorie intake and ultimately it will make the person obese. So try to control the weight and minimize the obesity. So these are the things that should be followed to avoid heart attack. And if the patient has a family history of heart disease, like a father, mother, grandparents, they have a heart disease or they have a heart attack, so they are at the greater risk of getting the heart disease or the heart attack. So these are the common things that we can do in our day-to-day life, so that we can avoid the things in future. We can avoid the heart disease in future. And salt intake is very important. So because salt intake, we should reduce as much as possible. Up to minimum of 1.5 grams is sufficient for a person or average weight person, because when you increase the salt intake, it will increase your blood pressure, and when your blood pressure will increase, it will automatically increase the risk of the heart disease as well as the heart attack. So control the things, control your diet, take salt to the minimum, and sugars also. Omega-3 fatty acids these days are very important. The common diets which are rich in omega fatty acids like fish and the walnuts, spinach, these are things which are rich in omega-3 fatty acids, and they are known to be protective in this heart disease, as they prevent the heart attacks also. This is all I have to say about the disease and its prevention. I wish you a very healthy and a happy heart on this World Health Day. Thank you. Thank you so much.